We've seen a lot of improvement in public health access in the country. We've also seen the Haitian Ministry of Health really step up and take a leadership role in defining priorities and the needs of the population. Some key examples would be expansion of HIV services. We've seen a nearly a doubling of the testing of pregnant women for HIV, and also a doubling of the proportion of pregnant women who are HIV positive that are receiving drugs to prevent transmission to their infants. In another area, one of the things that emerged after the earthquake was the cholera epidemic. We've really seen the ministry take impressive action to expand information coming in about cholera, as well as treatment services available for the disease when necessary. One thing that in particular that they've done is they've recruited testing agents and water sanitation and hygiene agents for every geographic region of the country that go out and test water sources, provide information to the population about how to practice good hygiene, how to practice good sanitation, and really play a key role towards preventing cholera. Another area since the earthquake that has been quite impressive is the very proactive stance Haiti has taken on immunizations. They've really focused on recognizing the need to bring in new vaccines and to increase the coverage rates for vaccines that are used in their immunization program. Fundamentally, CDC's role in supporting Haiti is to improve the capacity of the Ministry of Health. By having buildings that will house both our staff and ministry staff together, we're able to effectively work with them in a way that will improve their capacity to eventually do this work without our support. So being there and placed with the ministry, we can count on the fact that we're going to learn what's functioning well, where there are improvements needed, and be able to quickly work with them to yield those common goals that are reduction of disease in the population and improved access to health services. I think the coalition of partners brought together by the CDC Foundation to respond to the need for physical office space for the Ministry of Health created by the earthquake was pretty remarkable in a couple ways. First, it represented a response to the need. The Ministry of Health building was destroyed during the earthquake, and having a functional space to work is one of the critical elements to the ministry being able to respond to the health needs of the country. Second, it really provided a catalyst for linking private investments to public investments. The Ministry of Health building put up through this partnership at the National Labs site will really create an opportunity for Ministry of Health staff to work on an everyday basis with CDC staff on the priorities set towards improving the health of the population. In that building we'll house 3 critical units for the Ministry of Health. That will be the surveillance unit that really is responsible for collecting disease information, the field epidemiology program, which focuses on training the workforce to better respond to emergencies and other health needs in the population, and the laboratory staff that house the National Laboratory that allow us to link laboratory diagnosis with clinical symptoms that we're seeing in hospitals. In this building, we'll have those ministry units, and we'll also have counterpart technical staff from CDC sitting side by side working through these issues together in an everyday way. As we all know, the world is an ever-shrinking place through global travel, international commerce, and how quickly someone can make their way around different countries of the world. We always have to think about how these investments can actually improve the health security of the United States.